Okay, let's dive right into it. There's some significant movement happening in Washington around Medicaid, right?
That's right. Yeah, the big story is the White House signaling, well, potential support for adding work requirements for many people on Medicaid.
Work requirements, but
And it's not happening in a vacuum. It's being folded into these discussions around the House Republicans' reconciliation bill.
so this isn't like a minor policy adjustment. We're talking about something that could really change who gets Medicaid.
Exactly. It could fundamentally alter access. We're potentially talking about millions of people who might be affected.
Billions.
If these requirements go through, yeah, a lot of folks could suddenly find they don't qualify for coverage anymore. It's a really key piece of this reconciliation bill the House is pushing.
And this is happening now, like imminently.
Very much now. The House Republicans are, actively hammering out the details on this bill. There's even talk of a vote possibly this week.
Wow. Okay, so fast moving.
Definitely. And it's all happening while they're also trying to figure out what to do about extending those 2017 tax cuts. It's all kind of linked.
Right, right. Now, I heard the term common sense provisions used for these work requirements. What's the idea behind that framing?
Yeah, that phrase came from the White House press secretary, Caroline Leavitt. The
Hmm.
thinking there seems to be positioning these requirements as, well, logical.
Logical how?
As in, it's common sense that if you're getting taxpayer-funded help, you should ideally be working or trying to find work. It frames it around reciprocity, give and take.
Okay, so what might these work requirements actually look like in practice? Do we have any details? Are we talking like 20 hours a week, specific jobs,
Well, the specifics are still being ironed out. That's the thing. But generally, these kinds of requirements often mean someone has to work a certain number of hours per week.
or maybe training?
Or, yeah, participating in job training, something like that. Usually, there are also discussions about who might be exempt.
Like people with disabilities?
Right. People with recognized disabilities, maybe seniors or parents caring for young children. But the exact definitions who qualifies for an exemption, that's all crucial detail that needs to be in the actual legislation.
You mentioned the link to the 2017 tax cuts earlier. How do Medicaid work requirements and tax cut extensions end up in the same legislative vehicle?
Ah, well, that's where the reconciliation process comes in. Reconciliation bills are specifically about budget matters, spending, revenue, the debt limit.
And they have special rules in the Senate, right?
Exactly. They only need a simple majority, 51 votes, not the usual 60. So parties often use reconciliation to pass major fiscal priorities.
Okay.
So in this case, adding Medicaid work requirements could be seen as a way to potentially reduce government spending on healthcare.
Which could then help offset the cost of extending the tax cuts.
Precisely. It becomes part of a larger fiscal calculation, linking healthcare policy with tax policy.
So looking at the arguments for these work requirements, what's the core philosophy there? Why do proponents think this is a good idea?
Well, a primary argument is that it incentivizes work. The idea is it encourages people to find jobs, become more financially independent, and, rely less on public aid.
Makes sense from that perspective.
There's also the argument about responsible use of taxpayer money. The idea that able-bodied adults receiving benefits should be contributing economically.
And maybe transitioning to employer health insurance.
That's part of the hope, yes. Though, of course, whether good, affordable employer insurance is actually available to those individuals is a whole other question.
Right. So on the flip side, what are the main worries? What are the arguments against putting these requirements in place for Medicaid?
The biggest concern you hear is about vulnerable people losing essential health care. Think about folks who face real barriers to getting or keeping a job.
Like what kind of barriers?
Maybe lack of transportation, lack of affordable childcare, maybe health problems that make work difficult but don't officially count as a disability for exemption purposes, or just living in an area with few job opportunities.
So people could lose coverage even if they're trying.
Potentially, yes. Critics argue these requirements could disproportionately harm those already struggling. Plus, there's the whole administrative side.
What do you mean?
Just the complexity and cost of actually tracking everyone's work hours, verifying compliance, processing exemptions. It can be a huge bureaucratic undertaking.
Has this been tried before, like at the state level?
Yes, there have been state-level experiments, and the evidence from those is often cited by critics. Studies suggested they often led to significant numbers of people losing coverage, but didn't necessarily lead to big increases in employment.
Hmm. So if we zoom out a bit, how does this whole debate fit into the bigger picture of healthcare policy in the U.S.?
It really taps into a fundamental, long-running debate, doesn't it? Is healthcare a right everyone should have, or is it more of a benefit that can be conditional?
Tied to things like working.
Exactly. It gets at core questions about the social safety net, individual responsibility versus government support, and just the best way to help low-income people. Different philosophies lead to very different answers on work requirements.
So as we wrap this part up, looking at this reconciliation bill moving through the House, what's the main thing for people to grasp about these potential Medicaid changes?
I think the key takeaway is that the White House is now indicating support for including these work requirements. That's a significant development.
And that support could pave the way for major changes.
Yes, potentially very large changes to who qualifies for Medicaid and who gets that coverage across the country. It really raises the stakes.
But it's important to stress, nothing is final yet. The details are still being hashed out.
Absolutely. Who exactly would be impacted, what counts as work, who gets exempted, all those critical details are still presumably under negotiation as this bill takes shape.
It really puts the spotlight on that tension, doesn't it? The balance between, encouraging work and ensuring people don't lose vital healthcare access.
It's a really complex equation.
Yeah. And the outcome will have real consequences
Yeah.
for a lot of individuals and for the whole healthcare system. Definitely something to keep a close eye on.